Great day to you, my extinguished guest. I am Randolph Tan. I am pleased to present my final project, which focuses on fall prevention measures and implementation at Providence Little Company of Mary Medical Center, Torrance's Fourth Medical Cardiology Unit, which is also known as to be their stroke unit. The location of Providence Little Company of Mary Medical Center, Torrance, is in the South Bay area of Los Angeles, California. The hospital is recognized by the U.S. News and World Report as Los Angeles Metro's best regional hospital in 12 specific care areas, which are urology, orthopedics, colon cancer surgery, diabetes, heart attacks, heart failure, hip fracture, kidney disease, knee replacement, leukemia, lymphoma and myeloma surgery, pneumonia, and of course, stroke. Providence Little Company of Mary Medical Center, Torrance, is renowned for its commitment to patient care that is distinctly individualistic, utilization of cutting-edge technology, and emphasis on clinical excellence. The hospital provides a range of specialized programs and services, including advanced robotic surgery with the Da Vinci for gynecologic, urologic, and cardiac procedures, a heart center equipped with cutting-edge cardiac catheterization and angiography equipment and round-the-clock coronary angioplasty and open heart surgery, and a state-of-the-art obstetrical unit equipped with the country's finest facilities. I love the company's mission statement, which states, as expression of God's healing love, witnessed through the ministry of Jesus, we are steadfast in serving all, especially those who are poor and vulnerable. The company has a vision of compassion, dignity, justice, excellence, and integrity. The specialized unit at the hospital for stroke patients is the Fourth Medical Cardiology Unit. Every nurse is certified by the National Institute of Health Stroke Scale, which is the NIHSS, and is adequately trained to provide care for stroke patients. A total of 35 telemetry beds are available for use in the facility, which is managed by my preceptor, Dinah McGee. A total of 100 employees are under Dinah's direct supervision. The project is focused on decreasing patient falls in the 4 Medical Cardiology Unit. The unit has had 17 falls since the start of the year. Healthcare integration projects generally encompass substantial organizational transformations, aiming to enhance patient outcomes and services via the integration of healthcare functions. Data was collected in the beginning of the project. It was seen that there have been a total of 17 falls from the start of 2023 to September 2023, where all the data was gathered, and this was also the start of our class. The collated information is displayed on this slide. At first, I held the belief that falls were prevalent during shift changes. However, upon analyzing the data, I promptly refuted that hypothesis. However, I did observe that a number of these incidents were remarkably preventable. It drew my attention that of the 17 falls that transpired, 2 involved family members of patients. Upon reviewing the nurse's notes concerning the falls, it was determined that the primary cause was family members' irrational assessment of the patient's capabilities subsequent to a stroke. It was stated that the family did not know that the patient had decreased mobility, which was caused by the stroke. Then later on, it led to that fall. In 2 of the 17 incidents that I did observe, the patient was left in the restroom by a certified nursing assistant or a CNA. The patient chart stated that it was also the CNA's lack of education regarding mobility changes post stroke that had led them to assume that the patient is able to ambulate on their own, which later then caused the fall. The project's objective is to eliminate such accidents within the following 3 months. Calculations indicate that by preventing these 4 falls, the total number of falls in the unit could be reduced by 25%. So, what are the needed changes? Specific members of the medical personnel employed in the stroke unit may possess less comprehensive knowledge or training regarding patient conditions in comparison to the registered nurses. Certified nursing assistants, or the CNAs, had made the assumption that the patients were capable of independent ambulation in both of these instances. One of the implemented solutions involved the charge nurses reminding all employees during each pre-shift huddle not to leave any patients unattended in the restrooms. The CNAs were also briefed on the reasons why these particular patients ought not to be left unattended. With respect to the education of the family, the intended implementation of safety posters in patient rooms was to enhance family awareness regarding the potential impact of a stroke on their loved ones. I was able to construct a poster to help educate patients and their family members on what to expect after a stroke and how to prevent falls. I had the plan of posting all these posters inside the patient rooms so the visitors could easily read the messages on the poster. I titled it, How a Stroke Can Affect You. Please call and don't fall. I wanted to straight I wanted to translate in layman's terms the possible results of a stroke as best as I can. I just want to run down the points I've enlisted. Ataxia causes poor muscle control that causes clumsy voluntary movements, and it can impair walking and, most importantly, affect a patient's balance. The next one is concentration problems, which can contribute to making simple tasks such as walking difficult. Another is loss of sensation. This can cause loss of feeling on the affected side, which then again could greatly lead into loss in balance. Vertigo is another one. Strokes can cause prolonged and extreme dizziness, which can also lead to a fall. Vision problems. A stroke can cause blind patches, double vision, and movement problems, which can make balancing difficult. Spatial neglect. This is an interesting one. Stroke patients may actually forget to move their affected leg when walking because sensory information isn't sent to the brain. Lastly is perceptual problems. When a patient is not fully aware of their surroundings, balance is negatively affected. One thing I would like to add regarding this poster is that I added the Providence logo in it. If you could see it, it says it is located on the lower right of the um, poster. I will discuss in the next slides why this had led to a delay with the project. My stakeholders. The charge nurses were ready to jump in on the project immediately, and they did so by providing increased education and reminders to the employees and staff regarding fall prevention each pre-shift huddles. Fort Medical Cardiology already had a fall committee even before I began my project. I presented them my plans for the unit, and they too were very receptive about the idea. The committee stated that they loved the idea of the poster and was ready to have them posted in each of the patient rooms. The project was also presented to the administrators. Like everyone else, they were excited for the project and wanted to see if this would help with the fall prevention for the entire hospital. Other managers on different units liked the poster and wanted to have them in their units, patients' rooms as well. This is where things got a little tricky and challenging. Remember when I placed the Providence logo on the poster? You should see it on the lower right hand side of the poster. I did not know that it could cause such delays. The poster was liked by all the managers of Providence and the company in the area of Torrance that they too wanted the posters to be placed in their patient rooms. This then led to having the poster approved by higher executives since it bared the Providence logo. The posters was presented to the administrative management team for Providence Southern California region, and the poster was also liked. As great as this sounds, the poster is now being planned to be used in all Providence hospitals in the nation. Unfortunately, with aspirations that high, there had been more delays on approving the use of the poster. Before this class concluded, I did follow up with the progress of the poster's approval. They did mention that In the second quarter of the year, which is around April of 2024, the posters would go live and should be posted in every rooms. It would be nice to have seen if the posters would show effectiveness before this class concluded. For the last quarter of the year, which is the months of October to December of 2023, Fort Medical Cardiology Unit still experienced 5 patient falls. Out of the 5 reported falls, none of the incidents mentioned any family involvement, which was great. Unfortunately, 1 out of the 5 falls were due to patients being left in the bathroom. After reviewing the charts, it was stated that the patient was assisted to the bathroom by a certified nursing assistant or a CNA, and the patient requested for some privacy. The patient was then provided the privacy, and the CNA stood outside the bathroom with the bathroom door being closed. The patient then attempted to stand up on her own and was unable to do so because of increase in weakness, and this led to the patient falling on the floor. The sustainability of this project is, I believe, pretty high. One method to ensure the sustainability of the fall project prevention is to consistently remind the staff during pre-shift huddles about fall prevention. Posters regarding fall prevention could also be displayed in each room. With additional patient and family member education regarding the symptoms of a stroke, it is possible that falls could be avoided. We are in hopes for the family members and the patients to call for assistance every time that they do need to get out of bed until they are cleared by our physical therapists and occupational therapists. The current fall committee could also provide a lot of help for the fall prevention project. During one of the unit-based council meetings, I did meet with the fall committee and collectively discuss strategies to implement fall prevention strategies and hope of continuing the unfinished project. It would be beneficial to conduct a study regarding the fall after the posters have been placed in the patient rooms. Some upgrades could be added throughout the time and in order to prevent falls for the Medical Cardiology Unit. My conclusion. It never occurred to me at the outset of the project that fall prevention could be so challenging. It required significant thought and research to develop fall prevention strategies. I have acquired knowledge that falls are inevitable and do occur. As healthcare professionals, our utmost responsibility is to proactively prevent them in order to ideally avert potential fatal fall incidents involving our patients. I also did notice that it was unexpectedly lengthy to receive approval for a poster, particularly one that included the organization's logo for a project as straightforward as this one. Having come to the realization that it is not permissible to simply place content in patient rooms without subjecting them to rigorous scrutiny, large hospitals such as Providence are commendable in their diligence in guaranteeing that any item bearing their logo meets their highest standards. Throughout this rotation, my preceptor did teach me a great deal. I had the opportunity to observe her interactions with both her subordinates and her superiors. I had the privilege of observing her leadership approach and was able to witness the operation of transformational leadership firsthand. This gives me insight into the type of leader I hope to become one day. Again, this is Randolph Tan, and I do appreciate your time listening to my presentation. On this page, you would see the reference that I've used. I actually only use one reference regarding the abouts of Providence Little Company Medical Center. And again, thank you for listening and have a blessed day. God bless you. Thank you.